Good morning. Thank you for joining us. I'm Sarah Hom, Public Information Specialist here at the Health Department. Today is World AIDS Day. Today is December 1st, which is when it is annually commemorated. This day is an opportunity for people worldwide to unite in the fight against HIV, to show support for people living with HIV, and to commemorate those who have died from AIDS-related illness. Every year, our health department has acknowledged this day with some sort of activity to honor the lives of those affected by HIV and AIDS. While this looks a little bit different this year, well, because we normally do in-person events and testing, we're still looking forward to this conversation about the disease and sharing ways to prevent it from spreading within our community. With us today, we have Heidi, who is providing ASL interpretation, and participating in the conversation, we have Tracey Bathe from our health department and Dustin Hampton from the Missouri Department of Health and Senior Services. Tracey, if you wouldn't mind, go ahead and introduce yourself.
Sure. My name is Tracey Bathe, and I'm a health educator here, and I work on the HIV, hepatitis C, and STI prevention grant. And what I do here as it relates to our HIV prevention is we do education and outreach. So prevention education and outreach. So we go out into 37 different counties, not just Boone County, to do education. We also test for HIV, and we do counseling around that, risk reduction counseling around that testing. We also distribute condoms, lubrication, and oral dams for safer sex and our safer sex kits. We also facilitate mini grants for our 37 county region in case they want to do condom distribution or put together any kind of safer sex education themselves. So we help fund that. Well, we through Dustin, but he'll say that in a moment. And then we also oversee a community planning group for those 37 counties. So people in those 37 counties are represented so we can make a cohesive plan for our area. And when I say 37 counties, it's mid-Missouri counties and northeast Missouri counties. There are 7 regions and we're one of them. So, and we also, I'm just looking at my notes, we also have a website called showmecondoms.org. And so the grant helps pay for that, as well as on that website, there's of course a ton of education, but we are distributing condoms to order to individuals and also at-home HIV test kits that people can order as well for free. Lastly, we've just implemented a PrEP clinic. PrEP is a medication that what it does is it prevents HIV from replicating in the body. So it's a once daily pill that people can take to make sure that HIV is not transmitted to them. And so we have a clinic that we can talk to people about that and decide if that is something that is right for them. That's what we do.
Thanks, Tracey. All right, Dustin, if you would mind giving yourself a little bit of an introduction and what you do as well.
Sure, I'm happy to. Hi, I'm Dustin Hampton. I'm the HIV and STD Prevention Programs Coordinator at the Missouri Department of Health and Senior Services in the Bureau of HIV, STD, and Hepatitis. So the department is the recipient of several federal grants for HIV prevention and care, and also STD testing and treatment. My job is to coordinate those statewide HIV prevention testing and the response to all of that funded by those federal grants. So one of the ways that we do this is by partnering with organizations like the Columbia-Boone County Department of Public Health and Human Services. In the end, many of the activities and programs that Tracey just mentioned are funded, at least in part, through the grants that I coordinate.
Thanks so much, Dustin. We really appreciate that. And we appreciate the work that you do at the state level, especially the help that you provide us to be able to do our work here at the county level. So we'll just jump into some questions and you all can answer as you see fit. Yeah, there may be a little bit of different answers depending on if it's coming from a county level or state level, but some of these questions are just generally about HIV and AIDS and those who are impacted. So we'll just jump right in. So if you could just kind of walk us through some of the history of HIV and AIDS in America, things like how did it start and how has it changed over time?
Sure, I can take that. So in June of 1981, the first cases were reported. They were reported, and what they were seeing was kind of a rare cancer, Kaposi's sarcoma. They were also seeing unusual lung infections, and then so that's why it's the 40th anniversary in 81. HIV was somewhat ignored by the government, not necessarily by the scientific community, but certainly, by the government. So there wasn't a lot of funding or research widely happening. And so it wasn't really even mentioned that often by the White House or other places as well. So eventually around 1987, coverage started to change. Because at first it was mostly gay males that were thought to just be affected, but we were beginning to see that there were heterosexual males, women and children affected, people who were using needles for intravenous drug use. And so, particularly that's kind of when things the coverage started to change. And then AZT was a treatment option that came on board around that time, which gave some hope it was a large it's basically a treatment regimen. And so there could have been up to 25 pills sometimes people would have to take. It was quite extensive, but it was hope. The FDA approved that treatment. And so anyway, we were also looking at, starting around that time, children and teens not being allowed to go into their schools once they were diagnosed. So people were afraid and didn't know exactly how it was transmitted. Then you get into the early 90s, and people like Princess Diana and Elizabeth Taylor started to use their celebrity and become outspoken, and they literally touched people. And that was somewhat scandalous because people still didn't understand how you got it, but that was really a kind of another changing point for people beginning to understand they couldn't just get it through casual contact or touch. Around that same time, and by the way, I got into HIV work right around this time, 1982, but Ryan White was a teen. He was diagnosed with hemophilia, which meant that he had to get blood products because it's a clotting disorder. So with your platelets or blood transfusion in order to treat his disease and to treat hemophilia. And in doing that, before our blood supply was checked for HIV, which started to happen around 1992, he received a transfusion where he acquired HIV. So he became an outspoken person and kind of a face of, this needs to change, funding needs to change. And eventually funding did change, funding increased, and we actually named one of the grants after him. So that was a real turning point around 1992. We were seeing more people, more women, diagnosed, and the blood supply, as I said, around 1992 was beginning to be checked for the presence of HIV. We were also seeing other countries, in particular Africa, that was starting to get very affected. So this was a global impact as well. In 1995, the number one cause of death between the ages of 25 and 44 was HIV. Then in 1996, a new treatment regimen started, which was called ART, and that really changed the game. And that is now where people, number one, it's less medications a day, and we were able to take it from what was more terminal, not sure, AZT wasn't working for everybody, to now a manageable chronic illness. Which was a huge game changer. In 1910, we lifted a ban for anyone coming into our country with HIV, which was huge. In 2012, the FDA approved PrEP, which I mentioned earlier, as a drug to prevent HIV. So FDA approved it as a prevention medication. And then around 2017 to 2019, a study was completed, and we realized that if people take their treatment regularly who have HIV, they will have such low viral load in their system for HIV that it's undetectable. And when they're undetectable, they are not able to transmit it. So that's kind of the history of HIV. And my personal history is I started in 1992, worked in it through the 90s, and saw great changes. But yes, I was part of that where we were helping children get back into schools and really seeing so much stigma and so much discrimination. So I am so incredibly encouraged by the changes that have happened over the years.
And like Tracey, you did a great job kind of giving the social and some of the science history about HIV. But there are some other things that have changed with HIV, and really what's changed, I think, is how people react to the virus or how people react to those living with the virus. So in the early years of the epidemic in the United States, so little was known about how it was transmitted, how people got it, and how people could be cared for. And this really caused a lot of fear among people. Healthcare providers were resistant to interact or to treat patients with the virus, and people that had the virus were often discriminated against and faced a lot of stigma and prejudice. Now, 40 years later, after the recognition of HIV, we know so much more. We know that there are medications that can help keep people healthy, and like you said, with undetectable equals untransmittable, keep the virus at that undetectable level in people's bodies. We know that those individuals that have undetectable levels don't transmit HIV to other people and during sexual encounters. And we also know that we have a lot more tools in our prevention toolkit, including PrEP, that helps keep people from contracting HIV. Unfortunately, stigma is still one of those things that's a big remainder today. It keeps people from talking about HIV before encounters. It keeps people from seeking out HIV testing. And sometimes it even keeps people that are living with HIV from accessing the care that they need to stay healthy and to help prevent transmission to other people. So really, stigma is the next barrier that we've really got to address and break through to make a difference in the number of new infections and to lower the number of people living with HIV in the US, to end the HIV epidemic.
And Dustin, that kind of segues perfect right into our next question about the perception of HIV and AIDS and how that's changed over time. I mean, Tracey, in your timeline talking about how physically touching someone was kind of a big thing. And so, yeah, if you wouldn't mind, just talk a little bit about how that perception of HIV and AIDS have changed over the last 40 years.
Well, yes. So first of all, yes, it has. I mean, basically, when I started working in 1992, people, even within my friend group and family, they just were concerned. Like, are you sure that everything's okay? If you use universal or standard precautions in any setting, your casual contact is not a way that you are able to transmit HIV. So yes, I felt very, very, very safe, but yet I do understand that people just were very, very scared about that. So, while there about perception, a long time ago, people really thought that, or it was a terminal illness. It was something that there's not a cure right now, but the treatment is so incredible that people's health outcomes, if they stay on treatment, are just as healthy as people who do not have HIV, as long as they stay compliant with all their treatment regimen through their physician. So, but it was a terminal illness and now it's not. So the perception is changing for it to be more of a chronic illness and treatable, and people can live different lives, both, their physical health and sexual health and everything else is different. And so that's good. It's an improvement. People were really terrified of HIV. And I'm not saying that people aren't still scared of it now, but because of the high death rate at the time and not the lack of knowledge and the lack of research back then, it was scary in the 80s and 90s. But now it's a little bit different. We have amazing treatment, and so it's not kind of top of mind to be this terrifying, deadly, communicable disease. Although I will say, as somebody who tells people that they are they are positive, it's still very scary. And that's why we do prevention work. I mean, it does change their health. They do have to take a medicine now every day of their life. And So, and there still is stigma around it. So we want to prevent that, obviously, if we can, and help people reduce their risks. So again, that's why, PrEP is important. But anyway, I'm kind of segueing. But let's see. And then the other perception is that it was thought that this was just a illness or a virus that only impacted gay men. And that is not the case. And, it impacts everybody and anybody that has sex, particularly sex that's unprotected or that shares needles. And so I just think it's really important. I'm kind of reading off my notes, I'm sorry, but I just think it's really important that we look at the incredible stigma that's around sex and people that use IV drugs, and even those that are just in the LGBTQ community. It was not a priority to fund all of this for HIV in the past, and it's because of the stigma and discrimination. And the one thing that I hope changes is that, and continues to change with by the way, with every illness and every virus, and is that we have to remember that we are an interconnected global society. What affects one will affect all. So we have to work together as a global community to eradicate health issues and disparities, as what will affect what will affect one will affect all. And the shame that comes with any stigma that keeps people from accessing medical care and education they may need, that has to, we have to deliver healthcare, we have to deliver education that does not shame people, and that the stigma just goes away. So I want to be very clear, stigma at Columbia, Boone County Public Health and Human Services, it has no home here. So hopefully the perception of HIV and AIDS will change over time more and more, and eradicating stigma is one of the ways. So that's all I'm going to say.
So Tracey, I can attest that there is no stigma at Columbia Boone Health Department, but also to the amount of time that it takes stigma to erode away. So you mentioned that in 91, 92, whenever you got into the field, that your family was concerned because of stigma of HIV. So I started in the field in 2001, 2002, so about 10 years after you did. And one of the first things that a family member asked me is, well, you don't have to touch them, do you? So I certainly understand. And we have made progress, but there's still more progress to make. So like I mentioned earlier, HIV, the knowledge about HIV has improved, how it's transmitted, how it's not transmitted. People are starting to understand the basics. It's also gone, like you said, from a disease that kills within 6 months to a chronic manageable condition that with the appropriate treatment allows for a great quality of life. However, there's still this pervasive knowledge that people think that HIV only affects certain populations or certain people, and that's certainly not true. Although there are populations that are disproportionately impacted, certainly. The reality is anyone that engages in a behavior that could transmit the virus is potentially at risk.
Yeah, and I think that segues good into our next question too, Dustin. And kind of what we've talked about several times is the transition over the last 40 years of how much things have changed. And in some instances, 40 years doesn't seem very long, and in other times it seems like a very long time. And so if you wouldn't mind just kind of talking about over those last 40 years, what have we learned about HIV/AIDS that we know now that we didn't know before, and why that's important that we continue to kind of grow in knowledge and research and reducing that stigma?
Well, I think I kind of sound like a broken record, but you cannot get it through casual contact. You can't get it through a toilet seat. You can't get it through eating after someone. You can't get it through hugging them. You can't get it through basically being a household member with somebody. So it's just very important, because that really was not known a long time ago. And for people that lived through it, sometimes they still have those perceptions and may not, may still be a little bit fearful. So continuing to get the message out that casual contact does not transmit HIV is just really, it's very important, and that will decrease the stigma as well. And then, and that also impacts, again, you know, if there are, if there's any children or anything with it, or college students or anything, playing sports, going to school, all of those things, you cannot get HIV that way, especially if you are using, you know, universal precautions, if blood is present or anything like that. It's totally and completely safe. So, and the other thing that I also thought about too was that it's really exciting. You know, we're still learning, but now we have an opportunity 40 years later to start studying how HIV affects people in their older years, because unfortunately, people passed away before getting into their older, you know, the older years of their life. So we're able to study that now, and that will be very exciting as well.
Definitely. You know, yeah, I'm almost 40, coming up on 40, so it doesn't feel like as long to me right now. But we've learned so much in those 40 years. You know, so we've learned how to take care of people and the medications that work to keep people healthy with HIV, how to minimize or to lessen the level of virus or the number of copies of the virus in people's bodies. And we've learned that, you know, people that have that undetectable level don't transmit HIV to people. We've learned that condoms still work when it comes to preventing HIV through sexual transmission. And we've also discovered medications that help to keep people from getting HIV. The medication's over 95% effective. So we've learned so much. But you know, the exciting thing is so many of those things have come in the last 10 years or so. So the rate at which we're learning and figuring new things out is really exciting right now. And there are a lot of great things coming over the horizon.
Yeah, and so, you know, we're talking about how much things have changed, and really getting to study people with HIV at a longer time in their life, because yeah, previously it was something that, yeah, was terminal. And I think for those of us who know people who are positive, it's really encouraging that they get to live a full life now, when years ago that wasn't a possibility. And I think, you know, some of the things that we talk about is some of those notable people who are positive. And so if you wouldn't mind just talking about some kind of notable people who have been diagnosed with HIV and AIDS, and additionally, what you think that impact has been on the perception of the disease, with people having public figures in mind of people who are positive.
Well, first I wanted to apologize for my little, I had to make sure that my laptop was still working, and anyway, it's all good. I will go with who are notable people. I'll let Dustin talk about the perception changing, but Magic Johnson, that was a game changer in 1991, December of 1991. I remember the press conference, but that was a game changer. He was actually one of the first heterosexual people to announce in public, and that really changed the face of what people thought HIV, you know, was. Anyway, Freddie Mercury from Queen, rapper Eazy-E, Liberace, Rock Hudson, he was an actor, you know, in the 50s and 60s and 70s, Greg Louganis, the diver, Robert Reed, the Brady Bunch dad, Arthur Ashe, a famous tennis player, Charlie Sheen, famous actor, Jonathan Van Ness, for any of you that like Queer Eye, he's, and then Billy Porter, another actor. So notable people who have come forward and who have disclosed and have really helped with stigma. But I'll let Dustin answer more.
Yeah, so it really often is important and helpful whenever notable or famous people do disclose their status. But it's also important to remember that there are approximately 1.2 million people living in the United States with HIV. You know, between 35 and 40,000 new cases each year, according to the CDC. So when notable people, often they will spark conversation. So we talk about HIV, we talk about testing. and there's just an awareness building with those 1.2 million people that may or may not have disclosed their status to people that they know. It's important that we just in general normalize that conversation so that we talk about sexual health, that we talk about HIV and HIV testing, to really help to decrease that stigma and the discrimination and really the fear that surrounds the virus.
And I think you both said something really important there, that, these are the people who are notable that we're aware of, and that there very well are other people who we may know of who are famous or notable, who are positive and haven't disclosed that, potentially due to the stigma surrounding. And so, as we were kind of talking about what's next, hopefully that stigma will decrease and more people who are positive can live their lives and be known as someone who is positive and is living a full life, and that is a possibility. So I guess moving on to who is considered at risk for HIV/AIDS, what does that look like?
I'm going to let Dustin take that one. Go ahead, Dustin.
Sure. So really anyone could be at risk for HIV. It's not specific to certain populations. Anyone that has sex or use substances is a potential risk for HIV. Certain activities like sex without a form of protection or barrier method have higher risk, or injection drug use have higher risk for transmission. Some groups and communities, like men who have sex with men, have higher rates of HIV in their communities. And then, like I said earlier, certain populations have disproportionate impact of HIV. So for example, Black and Latinx men who have sex with men are disproportionately impacted by HIV significantly. Some studies estimate that Black men who have sex with men are about 1% of the population. And if you look at different studies, you'll see different percentages, but let's say 1% of the population, but they account for between 20 and 25% of all the new HIV cases. And that's just not acceptable. But there are a lot of reasons that is the case. Things like stigma, racism, homophobia, they're all factors with those new HIV cases, along with socioeconomic status and other social determinants of health. So one of the goals that the CDC has charged all of its new grant awardees is to start to identify and begin to address those social determinants of health, so that we can make an impact on that disproportionate rate of new infections. It's not going to be easy. There are a lot of them. And as in public health, we have a limited access to what we can do, but we have to do something.
Thanks, Dustin. Yeah, I heard someone say one time that can you imagine all of the mentors and experience and knowledge that we would have from people who are LGBTQ or Black men, people who are disproportionately affected, that we don't have in those communities, because they died of HIV and AIDS. And so thinking about that too, of just what kind of not only the people that we've lost, but that sense of community in some senses, that those mentors and other leaders aren't there anymore because of this disease.
Certainly. So if I can speak to that.
Yeah,
so
absolutely.
I'm a member of the LGBTQ community, and definitely I am of that generation where all of our elders and those individuals that would have been our mentors and our teachers, a lot of them are gone. And so we have missed that opportunity. But hopefully we're becoming those elders and the mentors for the next generation.
Yeah, that's a great point, that, because of the treatment that's available, because of the prevention, because of those efforts to reduce the stigma, yeah, hopefully that means that in the next generations, those mentors will be there. And that's a great thing to think about. So then just thinking about ways to prevent HIV and AIDS. So what are some of those ways that people can be proactive to prevent it?
Sure, I'll take that. Well, I'll take part of it. These are some ways that I'm going to say that will prevent all STIs, because if you're at risk for any STI, chlamydia, gonorrhea, you are at risk for HIV. And I think that that's, there's a lot of people who have been diagnosed with other STIs and besides HIV, and STIs, sexually transmitted infection, sorry. So I just wanted to say that. So some ways are limit your use of alcohol and drugs before sex. And just because that does affect, you know, how you think about things, and maybe affects the fact that you may not use protection, or you may not have conversations about status or anything, you know, if you are using something that kind of alters your decision making. We know that methamphetamine use is one of the newest drivers of new cases of HIV. So just, you know, obviously looking at reducing or preventing drug use and alcohol use is one way. Also using safer sex prevention methods. So again, use of condoms, use of lubrication, use of an oral dam for sex are highly effective. Also, taking PrEP, which I talked about earlier, to prevent. And for people who are HIV positive, who are in relationships with others, making sure they take their treatment to stay undetectable, which will make them not able to transmit the HIV. So that is prevention too. So all of those. And then maybe look at how the number of partners you have and try to limit that number. And or just know their status, you know, make sure that you're tested before a new relationship or a new partner. So that's really important as well, knowing your status and not having the stigma of worrying about getting tested. Everyone should get tested. Sexual health should just be, you know, interlocked with physical health and mental health. It's all just a big interconnected wheel. There should be no stigma about any of them altogether. We should be looking at our whole healthy selves. Trying not to share needles or syringes and other drug injection equipment. I'll get to this in a minute about what we help provide, but we at the health department here do help provide, trying to help limit that for people. And then also just adequate and comprehensive sexual education. We do provide that here at the health department and take that out into the community. And I know other groups do that as well. And so again, understanding and knowing our body is an evidence-based way of actually reducing risks of getting STIs and even reducing risk of pregnancy as well. So that's overall, but then I'll have, you know, Dustin can talk about specifically for HIV.
And you know, I think a lot of the things that I'll mention, they really echo what Tracey has said. You know, it's important to know how HIV is transmitted, the body fluids that transmit HIV, blood, semen, breast milk, rectal fluids, and vaginal secretions. Knowing those fluids helps you to know what methods or what activities you can do to reduce that risk of transmission. So we've already mentioned barrier methods like condoms and dams, medications like PrEP or undetectable equals untransmittable or treatment as prevention. People that are living with HIV take that treatment and can't infect other people. But then like Tracey said, it's also a good idea to have that conversation with individuals that you may engage with activities before you do that, because it's a lot more difficult to do it in the heat of the moment, shall we say. But to have those conversations and to make it more comfortable to have those open and honest conversations so that there's not as much anxiety about it. And again, just like Tracey said, getting tested regularly. If you engage in any of those activities, getting tested at least once a year, maybe twice a year, can really help to reduce that anxiety and the stress around testing. You know, I'm a big advocate of making it as common as having your blood pressure taken when you go into the doctor's office. It's just something that you do, and that way there's no anxiety around it.
That's great, Dustin. Thanks for those tips. So Tracey, if you wouldn't mind just talking about some of the services that we offer here at the health department on Worley Street for the prevention of HIV.
So we do rapid testing, which is free to the community on Thursday afternoons, but then we also do from 1 to 4, but and then doing a blood draw for HIV with our nurse practitioners happens during an STI appointment. And then certainly we go out into the community also and do our rapid tests as well. Again, we do the outreach education, the prevention education in the community. We also distribute safer sex kits, which I talked about earlier, which is the condoms, internal condoms, lubrication, and also oral dams. We also provide education and access to PrEP, which I talked about earlier. We have a PrEP clinic on Mondays from 3 to 5 here at our health department. We also provide the safer drug use kits, and those include bleach and syringe cleaning materials. Those syringe cleaning materials can also help with the ability to not share your supplies with another person. And the reason for that is that any supplies you use to inject drugs can, by the way, we don't do a needle, we don't have syringe services here, but it's everything else that can help you with that, with making sure that you do not share your supplies, because in those supplies used to inject drugs, HIV and hepatitis C actually too can be transmitted even through the supplies. I'm talking about cotton balls and things like that. So anyway, we do that. And so those are the things we offer. And I wanted to say 2 quick things about that. One, we provide these items, and we know that it does not enable both increased sexual activity or increased drug use. What it does do is it makes people more comfortable to come here and talk to us and access our medical services. We also let people know about recovery services for those that we talk to about our safer drug use kits. And so they have ongoing access to education from us. We build trust with them, and we build trust with the health providers here, so that when they're ready to reduce their risks, which they already are if they're accepting the kits, and they're coming in to see us. But if they come in regularly, we meet them where they're at, and we provide them with the resources to live their healthiest lives. And again, like I said, the more education that they have, the more open they are, the more it is that they'll access our services and continue to live healthier lives and reduce their risks. The second thing I wanted to say that I love to make sure that we do is that our clients, participants, people we educate, they become educators in their own community. They learn from us, and we're still learning. We learn from them too, by the way. It's a two-way street. So I want to be very clear about that. But we love the fact that once we bring that information to them, they will become educators, or they will refer people to us. And so we hope that that social interaction will continue, and that social network will continue to grow and grow and grow, which is exciting. So that's what we do here.
Thanks. And yeah,
and I'll talk a little bit about the state
go ahead,
level.
Dustin. Go ahead.
Oh, sorry to talk over you. So before I talk about what we do at the state, I really want to kind of just provide a little bit of information about what those rapid HIV test kits are like. A lot of people may only be aware of what we call conventional testing, where you go in and they do a blood draw and you get results a couple of days later. But with rapid testing, it's a finger stick. So just a drop of blood, and we can get HIV preliminary test results within 15 or 20 minutes. So it's not as scary as having to get a blood draw or anything like that. It's a lot simpler with results right there. And that's also the case with the HIV self-testing that Columbia Boone has available too.
Thank you for mentioning that.
You're welcome.
Because I didn't mention that before. And I'm gentle, by the way, when I do my finger sticks on people. I promise I'm gentle.
Yes, so at the state level, what we primarily do is we fund and coordinate the statewide activities and programs for HIV prevention and testing, like the ones that Tracey mentioned. We do have things like condoms and brochures available. So if there are organizations out there that would like to order them, we are more than happy to supply them for your organization, either to have out for so that people can take them as they need them, or residential areas, whatever you might need them for, we're more than happy to supply them. And we also have resources available, resources about PrEP, a testing locator, case management maps, all kinds of things. And that's all at our website, health.mo.gov/HIV PrEP, PREP. So that's health.mo.gov/HIV PrEP.
Thanks, Dustin. Yeah, thank you both for providing those services, because I think it's important too. Yeah, you're talking about how easy it is to do some of these things. It's just a prick of a finger, and you know, being able to pick up things like condoms that are available at our front door, basically. And so, just making sure people know that they can access it with as little barriers as possible. And I think that that's always one of our goals here at the health department too, is to reduce barriers for folks, because we want people to be able to access these programs without stigma, without judgment, and without any barriers. So I appreciate you both going over that. And with that, we'll conclude this chat here for World AIDS Day. And thank you both, Tracey and Dustin, for joining us. And thank you to Heidi for providing our interpretation today. And thank you everyone who has been watching this video. This is a very important topic that will continue to be an important topic. And for those of you who have lost loved ones due to HIV/AIDS, our thoughts are always with you. And so this is a day to commemorate those folks who have lost their lives. And so we'll continue to do our work. Tracey and Dustin will continue to do their work in this realm to reduce stigma and improve the outcomes of folks who are positive. If you do have any additional questions about HIV or AIDS, you can email us at sexualhealth@como.gov. Additionally, we have a website that you can go to. Tracey mentioned earlier that we mail out condoms to those counties that are in our region. So you can go to showmecondoms.org. Again, that's showmecondoms.org. You can find additional resources and information there, but also that's where you can order those condoms to be shipped to you free and discreetly. Also behind Tracey, we have, she's sitting in our clinic room, which has recently been renovated. So for folks who are coming in for services, we have a room that's dedicated just for you, that is inviting, and we have this new lovely art piece from 2 local artists. So we're proud to show that off, and that is also, some more information about that is also on our website at showmecondoms.org. But thank you all for joining us today, and again, thank you to Tracey and Dustin for your expertise, and thank you to Heidi for doing the interpreting. We really appreciate all of you, and thank you all again for taking your time out of your day to watch this video.